when thinking about melanogenesis as it relates to melasma, considering the milieu that the melanocyte is in and the various interactions it has and crosstalk that occurs with other cells, namely the keratinocyte, fibroblast, endothelial cell, is important to understand when thinking of melasma more holistically and approaching the therapy. So specifically, in response to UV radiation, keratinocytes release alpha MSH and other factors that induce melanogenesis, so they act directly on the melanocyte to increase pigment production. Visible light can act on the fibroblast to release factors including proteins involved in the Wnt signaling pathway, which in turn stimulate melanogenesis from the melanocyte. Endothelial cells release a substance called endothelin-1, and that is also in response to UVA and radiation, and that can act on the melanocyte as well to induce melanogenesis. So the melanocyte is getting inputs from multiple cell types in response to visible or ultraviolet radiation and reactive oxygen species to turn on increased pigment production. There's still a lot to be learned about what are the specific genetic predisposing factors for melasma. What we do know, though, from epidemiologic studies is that a positive family history is very commonly reported amongst melasma patients. When we look at global epidemiological studies, we see a positive family history in anywhere from 10 to 40% of cases of melasma, depending on the study. So it strongly suggests that there's some underlying genetic basis, but which specific genes are involved, that is something that has yet to be elucidated.